Hey everyone, it's Whitney Marima here, and I wanted to do a quick little presentation for you all about better digestion as a bariatric patient. I'm going to show you why your digestion is altered and why you might be struggling with certain GI complaints and issues when it comes to either breaking down your food and digesting it properly or absorbing the minerals and vitamins from it, and what you can do about it. So I have a little diagram here of the normal digestive tract and sort of kind of what happens at what places. And so what I really want to emphasize is that there are really three main digestive enzymes that have unique different functions. And so as I describe what they are, I'll later go into kind of what symptoms we can have as a result of not having enough of those particular enzymes. Okay. So first of all, we have stomach acid. This is primarily responsible for breaking down our protein. And it's sort of like I describe it as a meat tenderizer. It also keeps the pH of the intestines and stomach low. And low pH is what acid does, right? And so this is really important when it comes to protecting us from foodborne illnesses, things like food poisoning, viral or bacterial bugs that we might get of the GI tract. And just keeping our gut bacteria in check because we need our stomach acid to keep our pH low. The second enzyme that is super important is pancreatic enzymes. So here, pancreatic enzymes are going to break down our sugars, our starches, and carbohydrates. And they also go a long way into keeping the balance of good and bad bacteria in check. It's sort of like our police force, really, in our intestinal tract. And then third, we have bile. Bile is either released by the liver or the gallbladder. So if we still have a gallbladder, the gallbladder really collects this bile from the liver and it really makes it nice and concentrated. And then it is put into the intestine on the trigger of food ingestion to help us break down our fats. All right, so now that we kind of know that we have stomach acid, pancreatic enzymes, and bile as our three main digestive enzymes, let's talk about what happens as a bariatric patient and why are we different, okay? So first off, we, in either sleeve or gastric bypass, we have a significantly reduced size of the stomach, right? That was on purpose. But the downstream effect of that is that we have less stomach acid producing cells in that small stomach. So we have less stomach acid. All right. Now you might think, well, I'm eating less food. I should need less stomach acid. And that is true to a point. However, when we have less stomach acid, we have less ability to get our pH of the intestines to a low enough level that triggers the release of pancreatic enzymes, right? Because pancreatic enzymes are released based on pH of the intestines being low. So then we may, as a bariatric patient, be missing a gallbladder. Either we had it removed at the time of surgery or we had it removed because we got gallstones after our weight loss, or maybe we just had it completely unrelated years prior. But if we still do have a gallbladder, there is reasons why we would maybe still not be producing really good concentrated bile because we're eating less food, right? So if concentrated bile is released by the ingestion of a good sized meal, we're missing that trigger because our meals are much smaller. So with or without a gallbladder, bile can be an issue in terms of our digestive health, but particularly if you are missing a gallbladder. So what happens when we don't have adequate digestive enzymes? Well, a lot can happen. And a lot does happen. I see it regularly in my practice. So first of all, if we're not breaking down our food properly by either our stomach acid, our pancreatic enzymes, or our bile, and a combination of all three is likely at play for a bariatric patient, we are then sending undigested food throughout our GI tract. And it is literally an all-you-can-eat buffet for our gut bacteria, right? We have trillions of gut bacteria that are just hanging out in the intestines. They help keep everything in check. And but if we don't have our police force monitoring them and killing off the bad and letting the good, thrive, and so that the good can take care of the bad, we're going to end up with symptoms like bloating after a meal, lots of gas. We could have heartburn, and we just have a general overgrowth imbalance in the gut called dysbiosis. Overgrowth of gut bacteria cause symptoms in the patient like bloating after a meal. Let's say 30 minutes after a meal, you feel like you have to unbutton your pants, or like you're 6 or 7 months pregnant because you're so distended. This is really caused by overgrowth of gut bacteria secondary to ineffective digestion of food because of inadequate digestive enzymes. We also see symptoms such as irritable bowel syndrome, yeast overgrowths, something called leaky gut, which can cause a whole host of health problems. But we really see where leaky gut is the cause for the development of food sensitivities. And I'm not talking about just lactose intolerance or gluten intolerance here. I'm talking about things that your body starts reacting to that are everyday foods. And you might not recognize them because these food reactions create an immune response in the body that could be delayed up to 3 days. So it would be very difficult for you to pinpoint back to what you ate when you were feeling joint aches and pains, when you had skin issues, autoimmune conditions, and so forth. And all of these could be simply caused by, overgrowths in the gut, creating a leaky intestinal membrane, and then creating food sensitivities. Now, when we have poor breakdown of protein because of inadequate stomach acid production, we're going to have generally lower protein levels. I see this in practice where people will be doing 2 shakes a day plus meals and still have low or suboptimal protein levels on lab testing, where they're having difficulty gaining muscle, even though they're exercising or lifting weights. I see this also very commonly in people who complain of post-meal fatigue. Me personally, I experienced this for many years until I started taking digestive enzymes, where I would feel like I needed to lay down and take a nap 20 or 30 minutes after a meal, because literally all of my blood supply and blood flow was going to my digestive tract to do the work that my digestive enzymes weren't able to do. When we have poor breakdown of fat, the symptoms experienced by the patient is typically diarrhea. So if you're someone who has to have like a loose bowel movement every time you eat a meal, this is probably due to ineffective breakdown of your fat. If you notice that your stools float or they have a greasy look to them in the toilet, if you have unreasonably foul smelling gas and stools where people are leaving the room, they're complaining to you about it. This is really kind of key symptoms of ineffective fat breakdown based on ineffective bile. And we also see this clinically. I see it in trouble absorbing fat soluble vitamins, and those are vitamins A, D, E, and K. And so since breaking down fat soluble vitamins is dependent upon us, or not breaking down, having adequate amounts of fat soluble vitamins is depending on us breaking down our fats to extract those vitamins. I would see that ineffective bile production or release can be the impetus for fat soluble vitamin deficiencies. Now, when we have low stomach acid, I see this clinically displayed as poor absorption of vitamin B12 or iron. So these are people who are taking supplementation and still not really able to get anywhere with their labs being in adequate range. I'll also see it in the same, as I mentioned earlier, protein maldigestion. And so low protein levels on labs despite adequate amounts of protein. When I see inadequate breakdown of food, caused by low pancreatic enzymes, we can see this develop a manifestation called reactive hypoglycemia. Now, that might seem really complicated to you, but if you have it, you know it. So this is where about anywhere from 30 to 90 minutes after a meal, we're going to have, because we're not breaking down our carbohydrates, they're being rapidly absorbed into our bloodstream, and we're sending the message to our pancreas to release a ton of insulin in order to handle this rapid spike in blood glucose levels because of this undigested food. And as a result, this high insulin level, it does drive glucose down, but often drives it down really low. And so we can have experienced symptoms where we feel like we're bottoming out, or where we are having really symptoms of really low blood sugar, shaky, sweaty, maybe even passing out or feeling like you might pass out. And so this is called reactive hypoglycemia. And a lot of the reason for this is based on not enough pancreatic enzymes breaking down our carbohydrates. So my experience has been as a nurse practitioner, I really kind of wasn't filling the role that I really thought I might be, right? And so I sought out additional training, and that was in functional medicine schooling. So I became a functional medicine practitioner, and I started applying what I was learning to my patients right away. And so I started to, when anybody would come in, bariatric patients, and they were complaining of GI complaints, I would run a comprehensive stool test. And this stool test allowed me to see real numbers and data in terms of any overgrowth that they had, any pathogenic bacterial infections that they had, and did they have adequate digestive enzymes. It also gave me great insight into inflammation in the gut, leakiness of the gut, and other things that were really helpful in me helping the patient holistically. What I found in my bariatric patients is that 99% of them all had low pancreatic enzymes. And so what I started doing was putting these people on digestive enzymes, including pancreatic enzymes, of course. And what I found was that many of them got completely better from their GI complaints with just digestive enzymes at mealtimes. They also saw improvements. I saw improvements in their vitamin levels. And so they were taking the same supplement program, and all of a sudden their values were going up significantly. And so they were having better digestion and absorption of their nutrients. And very few of them needed to go on to have treatments for these overgrowths of gut bacteria that we found on testing, because simply adding in these digestive enzymes allowed for their bodies to get that police force back, where they were killing off the bad stuff and letting the good stuff grow so that the good stuff could take care of the bad. So that's called microbial balance, my friend. I recognized pretty quickly that the application for digestive enzymes in the bariatric patient was pretty universal, meaning there really wasn't many people who wouldn't benefit from them. And so what I broadly saw in people who I recommended and they took my recommendation was that they had less GI symptoms, less bloating, less gas, less belching, less heartburn, less diarrhea, less foul smelling stools. They also reported a lot of relief of this heavy feeling, especially after eating protein meals. You know that feeling where you just feel full quickly and it just seems to sit there really feeling heavy? They had less post-meal fatigue. They felt energized after a meal. They didn't need to sit or lay down or stretch or do any of that. And they had better absorption of nutrients. And so to me as a practitioner, this adding digestive enzymes to the bariatric patient was a win-win. And so we decided at Building Blocks that we needed to create one, because we needed one specifically really formulated to what a bariatric patient is going to most likely need. And that is all three of the digestive enzymes that I presented in slide 1: stomach acid, pancreatic enzymes, and bile, at a level that was, balanced, but in not too much, not too heavy of a strength based on the amount of food that we're taking in, which is less than the average person. So I want to just give a little bit of instructions for you when it comes to these enzymes that we created called Digest and Absorb. Gosh, I love that name because it's so perfect. And so the first thing is you should always talk to your medical professional before starting any supplements. Number 2, I recommend that you start off taking one at each meal. The label says one at each meal, and I recommend you start there, but it's possible that your GI complaints are not relieved with just one at each meal. And then if that is the case, you can go up to 2 and then finally go up to 3 per meal. And so you'll tailor it based on the resolution of the symptoms that you're aiming to get resolution of. And the way to take them is that you want to layer them into your meals, meaning you don't want to start with an enzyme and you don't want to finish with an enzyme because there's acid that's contained in the enzyme. So if you put it on an empty stomach, it might irritate the lining. If you put it on the top of a meal, it might irritate the esophagus. So we want to just sort of take a bite or two, take an enzyme, take another few bites, take another enzyme, and so forth. Okay. Now I know some of you that were trained by Dr. Marima and I know that you can't drink while you're eating. And so you want to ask the question, but I'm not supposed to drink while I'm eating. Yes, this is true, but we do need to get the pill into you to reap its benefits. And so, since Dr. Marima and I have both been taking enzymes for years, I find it super simple because I literally take a sip of water enough to get it into the back of my mouth and the top of my throat. And then I take a bite of food, and the food works amazing to push that pill down and not get it stuck or have any issues with that. So the food is going to really be your saving grace there in terms of not, because we're normally taking pills and we're taking it with fluid, we're having to take multiple sips in order to get the pill down. Food is way more effective than liquids at that. Okay, guys? And then the last thing is that the only real contraindication for who should not take enzymes is someone with an active gastric or duodenal ulcer, or if you've had one in maybe the last 3 months or so. So you want to make sure ulcers are well healed before taking the supplement, because again, it does contain stomach acid. And so my final remarks today are that I am super passionate about digestive enzymes in the bariatric patient. I mean, for one thing, when I saw that I was helping multiple people get rid of reactive hypoglycemia, I was totally in awe of the power of digestive enzymes, because I was seeing people. One of the most significant that I will not forget was a 30-something-year-old woman with young children who was no longer able to drive. She was afraid to go places because she would pass out regularly from this low blood sugar. She wore a continuous glucose monitor that would alert her when her blood sugar was going low. She had glucose tablets in her purse and she would eat them. And then this whole cycle would just start over again, right? So she was having multiple episodes a day. And just by taking digestive enzymes with meals, she no longer had any further episodes. So really remarkable for some conditions that were pretty debilitating, right? So enzymes really have the power to change digestive health, to prevent serious foodborne illnesses, to prevent bacterial overgrowth, yeast overgrowth that create all kinds of havoc on our GI tract and our overall health. And I lastly want to say that if you are someone who suffers from significant GI symptoms and that trying enzymes don't fix it, that you really are someone who would benefit from seeing either a functional medicine provider or an integrative health provider, somebody that has a license that can order comprehensive stool testing, figure out exactly what issues you have going on, and treat them specifically, because we have to test. We can't guess on some of these issues. So if you've been to gastroenterologist and you're not getting answers, I would highly encourage you as a next step to find a functional medicine provider near you that can help really do a deep dive into what is going on inside of that gut and start working one by one to treat them. And so thank you for my presentation, being here today, listening to this. I really hope that I've inspired some of you to have hope that you can feel remarkably better at mealtimes and afterwards by trying Digest and Absorb and just being aware of how much better you feel. So please, I'm going to provide the link to order the Digest and Absorb and a coupon code in the comments. So if you're interested, give it a try. It can't hurt anything. Thanks.